welcome to our frequently asked questions. Today I'm answering a question about blepharoplasty. Will I have a visible scar after upper blepharoplasty? Well, this is a common question that patients ask me, and I'm going to approach it from three areas. And the first is, in terms of a scar, why do I need a scar from upper blepharoplasty? How is it going to help me? Secondly, what is the normal healing for this scar? And thirdly, what can be done to either speed up the resolution of the scar or improve the final result? My name is Dr. Julian De Silva, and I'm a London-based facial cosmetic and plastic surgeon, and blepharoplasty is a common procedure that I complete for my patients every single day. So in answering this question, will I have a scar after upper blepharoplasty? Well, why is a scar necessary? Well, as part of upper eyelid surgery, often there can be excess of skin, loose skin in the upper eyelid, and this can either create increased folds or a droopiness in the upper eyelid that tends to give you a more aged appearance. And when you look back at younger photographs from 10, 15 years before, often the skin is smoother in the upper eyelid and there isn't the same degree of looseness. And so a scar is required in order to remove that loose skin and improve the texture of the remaining skin. And so that scar can be hidden in the natural crease of the eyelid. And so when you look down, there is a natural crease, a natural fold in the eyelid, and this fold can be generally used to hide the scar from upper eyelid surgery. So in terms of the scar, how does it heal? Well, generally speaking, 1 week after the surgery, the scar can be a little bit lumpy bumpy and a little bit pink in color. And this is normal for any scar anywhere in the body. However, with time, this natural lumpy bumpiness and pinkness will fade, and generally speaking, the upper eyelid will improve to give you a very fine scar and fine line. How long does this take to occur? Well, in many patients, even after 6 weeks, the scar can be relatively smooth and relatively normal in color. However, in some people, this process can be much slower, and the very final result of any scar from upper blepharoplasty can be as long as 18 months. So there is a small risk with any kind of surgery of a scar that can be unsightly. And generally this scar, or this risk of having a scar such as this, such as keloid scarring, is a fraction of 1%. It's a very small risk. However, if you do have a tendency towards keloid scarring or any other scarring type issues, it's important to tell your surgeon so that they can take that into account. And certainly precautions can be taken in order to minimize scarring after upper blepharoplasty. Well, what can be done in order to speed up healing and resolution of the scar? Well, firstly, in terms of the surgery and the surgical technique, well, measures can be taken in order to speed up the resolution of that scar, and that can include the use of laser and platelet-rich plasma that speed and enhance healing. It can involve the use of bio-oil or silicone gel after the surgery that tend to speed up the healing. Both of these products work in slightly different ways and will generally aid healing when used with gentle massage. So in summary, we've talked about upper blepharoplasty and why a scar is generally required in order to give you the best possible result. We've also talked about how long that scar will tend to fade and heal. And finally, we talked about measures that can be taken in order to enhance healing and give you a result in a faster time. I hope this information has been useful. Thank you for watching. If you would like further information about having blepharoplasty or eyelid surgery, please have a look at Dr. De Silva's book. This is a comprehensive patient guide with over 250 pages, including color illustrations and photographs, including all commonly asked questions and fears that patients have. This is available through either Dr. Julian De Silva's website or by searching on Amazon.